Hi, my name is Kevin. I'm gonna be your nurse practitioner today. Today I'm gonna be performing the head, the eyes, the ears, the nose, the mouth, your throat, and your neck assessment. I'm gonna start by first inspecting your skull, assessing the size, the shape, and the contour. I'm gonna also inspect your scalp for any scales or lesions. I'm gonna be palpating your scalp, feeling for any masses. Let me know if there's any pain.
No pain.
Perfect. As I'm also palpating your scalp, I'm looking at your hair, looking at the distribution, feeling for the hair texture and the quantity. Everything is looking good. Now I'm looking at your face, looking for symmetry or any involuntary facial movements, which is not as present. Now I'm going into the eye assessment. I'm looking at your eyebrows, the positioning of your eyes. I'm looking at your sclera, which is white. Perfect. I'm gonna look at your conjunctiva. I'm gonna let the eyelids down. The conjunctiva preview is nice and pink. Now I'm looking at your lenses, your cornea, and the iris. I'm looking at both symmetrically and they're all normal. Now I'm gonna be looking at the pupillary response, assessing for your pupils to be equally round and reactive to both direct and consensual lights, which they are. Now I'm gonna be assessing the conjoinings of your eyes. So look at my finger, and I'm gonna put this forward to your nose. This is the convergence of your eyes, very good. Now I'm gonna look at the accommodation reflex. Look at my finger. I look at the clock behind me. I look again at my finger. Very good. When you look at my finger, your pupils constrict. When you look at the back, your pupils dilate. I'm also going to do the computation test by assessing your peripheral vision. So I'm gonna put my hands behind your ears and I'll bring it close to me, and you tell me when you see my hands, okay?
Mm-hmm.
All right.
I see it.
Perfect.
I see it.
Perfect. One more time.
I see it.
Perfect. Now I'm gonna look for your six cardinal, your six gaze cardinal visions. This is gonna measure your extraocular muscles and your extraocular movements. So look at my eye, look at my finger again, and follow it, okay, with your eye. Very good. Perfect. Everything's intact. No mistakes noted. Now I'm gonna look inside your eye. So I've got my light. I see the red reflex, and I'm gonna go follow it all the way to the back of your pupil. And within there, I see the structures of the apsidus, the retinal vessels, the optic disc, and disc and cup. And I'm gonna do the same thing over here, and I'll be comparing it. Very good. All structures are normal. Now I'll be assessing your ears. First, looking externally, looking for symmetry, looking for any discharge, any swelling. I'm gonna be pulling onto your pinna, up and downward, and let me know if there's any pain.
No pain.
Perfect. If there were to be pain, this indicates infection. But since you said no, there's no infection here. I'm gonna do the whisper test. So you're gonna occlude one of your ears, and I'm gonna whisper syllabi, and you're gonna let me know what I said, okay? Banana.
Banana.
Very good. Occlude that again. Perfect.
Apple.
Perfect. Now, lastly, I'm gonna do the Webner and the Rhine test. The Webner is gonna assess for hearing loss. I'm gonna place this in your forehead, and let me know if you hear this or feel this.
I feel that.
You feel it, and let me know if it's in both ears or just one ear.
Both ears.
Perfect. Your hearing is intact. I'm gonna do the Rhine test now. I'm gonna put this behind your ear, and let me know if you feel this, okay?
Yes. I feel it.
Okay. Do you feel? Do you hear? Feel this?
I hear it.
And let me know when you stop.
It stopped.
Perfect. With the other one as well. You feel it?
Yes.
Let me know when it stops.
It stopped.
You feel this? Or here?
I hear it.
And let me know when it stops.
It stopped.
Perfect. This is normal. This proves that air conduction is greater than bone conduction. Okay. Now I'm gonna be going assessing your nose. I'm gonna looking for any deformities. None is present. I'm gonna touch your nose to see if there's any pain. Let me know if there's pain.
No.
No, perfect. I'm gonna look inside your nose to look at the mucosa and the nasal passage. Your mucosa is nice and pink. I'm looking for your septum to see if there's any deviation, which there's no deviation noted. I'm also looking if there's any nasal polyps, which there's not noted as well. Perfect. Now I'm gonna feel for your sinuses. Once I'm gonna touch, you tell me there's pain, okay?
Yes.
This is your frontal sinuses.
Mm-hmm.
This is your maxillary sinuses. Is there any pain when I
Nope.
touch?
No pain.
Perfect. Now I'm gonna look at your mouth, okay?
Yes.
I'm gonna first inspect your lips to see if there's any sore, any cracks, or any ulcerations. I don't see none of that. Can you smile for me, please? Very good. I'm looking at your teeth, nice and white and straight. I'm looking at your gums as well. Very good. I want you to open your mouth for me. Very good. Stick your tongue out. Your tongue is nice. There's no swelling in your tongue. Now say ah. Perfect. Now I'm looking at your tonsils, your uvula. Very good. Everything is present. Now lift your tongue up. I'm looking at some submandibular and some lingual glands. They're present. Very good. Now I'm gonna look at your neck. First, inspecting to see if there's any masses or anything noted, which is not. I'm gonna feel for your pulse. And if I touch and you feel any pain, let me know, okay?
Mm-hmm.
Your pulse are present. Very good. Now I'm gonna feel for your lymph nodes, all right? So as I'm touching, you let me know if there's pain, all right?
Yes.
All right, so this is called the preocular. This is the postocular. This is the occipital, the tonsillar, the submandibular, the submental, the superficial cervical chair, the deep cervical chair, the posterior cervical chair, and the supraclavicular. Okay?
Mm-hmm.
Very good. Now I'm gonna look at your trachea and I'm gonna feel it. I'm seeing if it's midline, which there is, or if any deviation of the trachea, which is not present, okay? Your trachea is nice midline. I'm also going to be feeling for your thyroid. If there's any pain, let me know, okay?
Yes.
I feel your thyroid. Nice. There's no nodules felt or anything like that. The size and everything is normal. Very good. Now I'm going to ask you to stand up and I'm going to check your cervical spine.
Yes.
I'm going to trace your cervical spine down to see the alignment. There's no scoliosis noted, and it's aligned perfectly. Perfect. And this pretty much concludes the HEENT exam. Thank you very much.
Thank you.